My name is Renee Duff, and I'm Vice President for Cancer Support and Outreach at Mary Bird Perkins Cancer Center. Through our work with taking aim at cancer in Louisiana, we had the opportunity to learn more about the impact of cancer throughout the state and where there were huge gaps. And so we were approached by the then medical director of Blue Cross Blue Shield of Louisiana to work together to see if we could identify an opportunity to have an impact in the Delta region of the state. So one of the first things we did was, which button do I push? Oh, there we go. The first thing we did was to conduct a community needs assessment in 2019. And we looked at a number of health and socioeconomic factors from that region. And what we discovered was that the Delta parishes are ranked among the least healthiest parishes in the state of Louisiana. So you can see we're in these three parishes, East Carroll, Madison, and Morehouse, are 63, 62, and 61 out of 64 parishes in our state as being the least healthy. So that led us to know that there is a need. So we looked at a number of the health factors that contribute to cancer, and tobacco use is one of the largest ones. And it's also a preventable cause of cancer if people would quit using tobacco. And so the state average of adults that use tobacco is 23%. We had two parishes that were far in excess of that, with East Carroll at 33% and Tensas at 30%. However, all 12 parishes in the Delta region that we currently serve now have a smoking rate higher than the rest of the state of Louisiana. We heard a wonderful presentation this morning about obesity, which is also a risk factor for a number of different types of cancer. And all 12 Delta parishes have an adult obesity rate that is significantly higher than the rest of the state. And the parishes listed here are all in excess of 40%, with one being at almost 50% of the adult population are considered obese. Then access to health care is another contributing factor to catching cancer early. And so here, our needs assessment demonstrated that there are parishes that have the ratio of primary care physicians to the population is significantly high. With Catahoula Parish, there is one primary care physician for almost every 10,000 citizens in that parish. So access to health care is significant in that area, which led us to look at the cancer rates for those parishes in the Delta region. And I know this data is small, and when you get the presentation, you'll be able to see it, but the number of cancers that were diagnosed in these regions was not a very large number when you look at the raw number, but when you compare that number to the population that is within those parishes, which is all very, very small other than Ouachita Parish, it's significant. And so that led us to work with Blue Cross Blue Shield Foundation to receive a grant award to be able to go and bring our life-saving cancer screenings into that market. So I'm going to turn it over to my colleague Heather Johnson, who is going to share with you about our Prevention on the Go program.
Prevention on the Go, that's our mobile medical screening program, and I'll give you the history of kind of how we started. We started here in Southeast Louisiana in 2002. The Care Network program was brought to the table by our board of directors. Before that time, how we were treating cancer was you were diagnosed for cancer, we would treat you in our center. So our board of directors wanted to take a more preventable approach to stop cancer before, to prevent cancer before it's found in those, and to promote early detection. So in 2006, to expand on our program, we started the screenings in 2002 for the 5 preventable types of cancer: breast, prostate, colorectal, oral, and skin cancers. 2006, we needed to address a further need, and that was access to care. People were having trouble coming into the brick and mortars to complete the screenings to find the cancer early, so we deployed our first mobile medical clinic, Early Bird 1, in 2006. And to further address access to care, 2008, we initiated our patient navigation program. What our patient navigation program is, it's a program where we have a nurse navigator that not only, it follows everyone with an abnormal finding. And so that's unique about our program. So not only do we get them into screen, as Renee discussed, these people have various social determinants of health and various other issues that that they display or they present with. So having a navigator with them to help them schedule appointments to address any of those needs that they need that's preventing them from completing all the way to a diagnosis. 2013, through some funding from BP oil spill, we were able to purchase our second mobile that was deployed in the Bayou and North Shore regions. In 2016, we rebranded our program to Prevention on the Go, and we began offering workplace-based education and screening. We found at that time that even people with insurance weren't using their preventive services to have those type of screenings. Time off work, missing work for appointments. We all know the hustle and bustle. You and I, probably the majority of us have insurance in here today. And to take off time off work, miss work, we're at work and end up canceling an appointment because something ran over. It's just that access factor of eliminating that even for those who have insurance. 2020, through the funding through the Blue Cross Blue Shield Foundation, we expanded our reach from 18 lower Southeast Louisiana parishes to now serving 30 plus parishes, almost half the parishes in the state when we expanded with those 12 parishes in the Delta region. In 2021, we reached our 100,000 screenings since the inception of our program in 2002, and our third mobile medical clinic went into production. So our third baby is in production right now, and we hope that we have a birth somewhere in the next 2 months or so. It's a 9-month process, trust me. So these are our 2 mobile medical clinics that we have currently, Early Bird 1 and Early Bird 2, very original. And Trey is coming, it will be Early Bird 3. Our Prevention on the Go program is made possible through partnerships. So one of our longstanding partnerships with Women's Hospital, they go out with us. Our mobile clinics are outfitted with exam rooms. It will look the normal exam room that you walk in when you walk into a doctor's office, outfitted just like that. Both of our mobiles are outfitted with exam rooms, so we're able to offer those screenings. But when we offer our breast screenings, we accompany Women's Hospital. Breast mobile accompanies us. They have 3D mammography on their breast mobile. So our clinician is able to offer a clinical breast exam on our mobile, write the order same day, and those participants go right over and have, that are eligible, go right over and have that mammogram if they are within screening guidelines. So as we women know who are eligible, age doesn't happen that quickly and not as seamless like that. You may go to your doctor, get a visit, they write the order. You may or may not get the test in a day, and it surely doesn't happen within an hour or an hour and a half. So, just some more information about our program. We register on site. Some good things that we've been able to enhance are pre-registrations through an electronic system. It's custom made for our participants. They can call on the phone. We do risk assessments for the screening types. We're able to collect demographic information, so that further makes the visit quicker for them. So if they're coming over on their lunch break, our after-hour screening, if they're trying to get to us between the time it takes them to get to work, have their breasts or have their screening, then get home and cook or prepare for their children. We have after-hour screenings between 5 and 7 that we offer. Saturday screenings, so if they can get to us while they're out shopping and they have that time allotted, get their screening quickly. We're just trying to cut down on that time it takes for them to have that screening and to integrate that into their normal daily life. But this is just a visual representation of how we register their screen. They see our clinicians. Our nurse navigator is there, and we educate on site. So we try our best while we have them there to capture everything at one time. So if we can do combination screenings, if we have a woman that needs multiple screenings, a colorectal kit to take home that we offer, a breast screening or a skin screening, we try to combine those so we can get that all taken care of at one time. So as we embarked on the Delta Project, we knew we had some preconceived barriers or challenges that it would take to take on a project like this. Navigating a new market. We're Mary Beth Perkins. We've been in Southeast Louisiana for 50 plus years. And so we're known, our cancer care and our treatment, we're known here, but to navigate a new market, we knew we would face some challenges. Minimal brand recognition, one of those challenges. Getting community stakeholder engagement. They started off with listening sessions, going into the different parishes and getting an idea of what the perceived notion of what the need was, because we can sit and crunch the numbers all day and we can tell you exactly, like, try to tell the community what they need, and they could have a total different perception of what the immediate need is. We're telling you you need a cancer screening, but you're telling me that you didn't eat last night. So other things need to be addressed before what we've assessed can be addressed. Healthcare community collaboration versus competition. We all know how that is. We have a lot of wonderful, great programs, and a lot of them span each other, offer some of the same resources. So how can we supplement the resources that we have? With our program, grassroots outreach is a big part of our program. We have a lot of, mobile outreach coordinators go out to the community. So your program may offer, other programs may offer breast screenings and have them available, but we can use our grassroots outreach coordinators that we have on staff to drive that education and to, like I said, to let community members know you actually need this, you're eligible for this to even have it. It's enough to have it available, but how do you link the two? And so that's a part of the collaboration in our grassroots outreach coordination program to help tie everything together, even though the community may have some of these same resources. Local MBPCC representation. We didn't have anyone locally in that area. We don't have a cancer center in that area. So to have someone boots on the ground that's connected, that lives in that community, to make those relationships, to help us bridge the gap and bring the persons to the table that needed to come to the table to make this all work and to address the actual need, which leads me to Myra, and she'll speak to some of the challenges and outcomes and growth that she's been able to overcome. But COVID-19 pandemic, we all know when it came. This program took full steam. I believe Renee was in the middle of a listening session when she got the call to get on a senior VP call that we may be shut down in a couple of days. So that's how in the moment, and that's how full steam we were, and then it came to a complete halt. But that delayed our relationship building with community stakeholders. I believe they finished half of the listening sessions that were scheduled, and then we got the call that we were going on lockdown. Delayed start, so we didn't start our program when we wanted to start. Our screening program actually shut down for about 2 to 3 months, 4 months following that. Postponed screening and education efforts that brought along delayed grassroots efforts, and we know after COVID, a return to screening hesitancy. So we had an uphill battle that we had to face in the middle of starting our program. And I'll let Myra speak to some of that.
So now we're at September 2020 when I was hired, and we're in the middle of COVID. I'm sorry. Which one? Okay. And so we have all these goals that we've got to accomplish, and I'm a new employee, so I'm looking at the list and trying to figure out how we're going to do this. Some of the challenges, of course, was when we start screenings again, making it safe and people feeling like it's a safe environment to actually have these screenings. We started having people do appointments so that we could space them out. We limited the number of participants as well. Our education and outreach, we started doing it in a virtual environment where we offered social media campaigns because we knew a lot of people are on social media, as well as offering quizzes for help us with our education on social media as well. And then trying to think of other ways where we could get education and what we were trying to do out to everyone. So the food bank of Northeast Louisiana, they distribute food boxes, and so we partnered with them, and I started going to they did have mobile drop points, and so I went on a lot of those because I wanted them to be able to see who Mary Bird Perkins was and what we were doing, and we were putting educational materials in the boxes, as well as Monroe Housing Authority. I had a friend that worked there, and we were talking, and I realized that, maybe we could do screening in these areas because they had all these housing developments with seniors and families. And so we distributed education materials through them, as well as started having screenings there. We were able to do it by appointment, space them out. They were glad to get out of their homes, and they were taking advantage of it, and that was a great thing. And it was something that I think Mary Bird had not done before. Everything had been very public, but because of COVID, it caused everybody to adapt and be flexible and think out of the box and think, what can we do to still reach people? And so that's kind of how we started doing that. Also, when we couldn't do everything in person, I started making calls and calling city governments, mayors, going to city council meetings when that opened back up. Every organization that I could think of, and of course, just as we have found out here today, having a conversation with someone, they give you a name, that leads you on another journey, which leads you to somebody else that's a good partner. And so we did a lot of that. We've created over 45 plus community partnerships. Some of those, 9 of them are healthy community coalitions, which a lot of you may have in your communities. They're under the LSU Ag Center. And what I found is all of those organizations are doing health-related things, and we're all trying to reach the same people, and they're all good about working and partnering together to figure out how we can work together and get to serve more people. We've had education and screenings in all 12 parishes. We've gone into not only just the main areas of those, or the heavily populated areas in those parishes, but even into the towns and villages. We've done over half of those. And it's been really nice because, especially like when I went to West Carroll Parish, everybody has everything in Oak Grove, and I'm in the little communities like Pioneer and Forest, and there's like, why are you here? And because we want to reach everyone, and give everybody the opportunity. They said, well, everything goes to Oak Grove. So that made me feel good that we took the time to go there. We've had other partnerships. We partner with the university's nursing program, Kitty Degree, also the Louisiana Municipal Association. They helped distribute our stuff about what we were trying to do to all the municipalities. That helped reinforce what we were already trying to do. Delta Interfaith is another one. Washita Parish Housing, after we did Monroe Housing, they came on board and were helping us. And right now we're in the middle of forming a partnership with the Northeast Delta Human Services Authority. Very excited about that because they have a new mobile clinic, and we're going to partner with them and go to these various places. Is that 1 minute of questions?
Almost done.
Okay.
Keep going.
Okay. Let me see where we're at. We have completed 694 cancer screenings, and that was through 88 screening events. We've had 9% of abnormal findings with 1 cancer diagnosis. And as Heather said, we have a nurse navigator that helps those people with the next steps. They're not just diagnosed and left to figure it out. We found that 70% of these people have never been screened, or they've never followed any kind of screening routine. A lot of them, when we ask their questions, we ask them, you know, when was your last screening? And they'll say, well, the last time I was screened, I had polyps, but I haven't been back in 8 years. Well, if anybody's ever had polyps, you know, you don't wait 8 years to go back. So we found a lot of those as well. We have...
Myra, in the interest of time, we're going to rush through the rest of these slides real quick.
Sure.
As part of our growth, we have a new mobile unit that's going to include mammography that's going to be dedicated for this market. We're expanding additional screening types in the Delta. We have a new data system, MyPogo. And for long-term sustainability, we're looking for additional funding sources, and we plan to introduce our workplace program in this market. We've expanded our partnerships, of course, with Blue Cross Blue Shield, Louisiana Department of Health, Women's Healthy Blue, and we're creating additional partnerships. Coming soon to the Delta region, we will have Live Well Delta. This is our signature event that we do in all of the markets we serve, and it is a comprehensive event where we do all 5 screening types that we do. We do biometric screenings, we have healthy cooking demonstrations, fitness activities, music, food, door prizes, everything. So we're going to be having this in the Delta region in September 17th. But if you want to get a taste of what Live Well looks like, on May 14th here in Baton Rouge, downtown Baton Rouge, we will be on Spanish Town Road beginning at 8 o'clock with yoga, and then all of our screenings until 1 o'clock. You can come by and see what it looks like. This is our team. We thank you, and we'll take any questions.
Thank you so much. Questions from the group?
Question down here.
From Lafayette, Mona. We have a little group there that says it's called Check Your Jugs, and are you familiar with it? It's Lafayette. You know, gotta have a sense of humor.
Protect your pumpkins.
But I was just wondering if you were one of those that's helping sponsor that group, or no? Are they like
we don't sponsor.
Rogue? They're probably
look for
just
sponsors.
rogue. Yeah. Okay. All right.
Our program is funded through philanthropy and grants. And I don't know if any of us even said it or not, but all of these services that we provide through this program are at no cost. And that's because of philanthropy and grants.
Other questions?
For your grassroots component, what kind of strategies have they utilized? Has it just been going to community meetings or other things or one-on-one meetings?
It's a pretty vast array of things that we do. As a matter of fact, at one event Myra's had up in the Delta region, they actually went door to door, knocking on doors, inviting people to come and get screened. But our outreach coordinators do go out into the community and give out flyers. You may see them anywhere you go. I actually stopped at Bergeron's across the river on my way to Alexandria a few weekends ago and saw the bright pink flyer for advertising a screening. So we leave them at different places like that. We've developed relationships with faith-based organizations, and we send out electronic flyers to them. We do a lot of radio advertisement. Social media has now become another platform for us to use to do grassroots outreach, but word of mouth is powerful. Our program has been in existence for 20 years now, and so a lot of people come to us year after year. As a matter of fact, the person who was our 100,000th screening participant had been with us for 10 years. She started coming when she didn't have health insurance, and after she got health insurance, she continued to come.
Could the screenings be run through the patient's insurance to help with the cost of the program?
So our breast screenings, if a woman has health insurance, Woman's Hospital will bill her insurance for the mammogram, but we do not charge for any of the physical exams. All of our screenings are, other than the mammogram, are physical exams. So it's actually a physician or a nurse practitioner that's conducting an examination.
Right. Well, thank you once again, Mary Burt Perkins team. Join me in thanking them.